Please, somebody tell me why we are here considering a bill that is a direct attack on a woman's constitutionally protected right to choose and that does not create one single job.
So you might have heard recently, the American people, turns out, super interested in having Congress focus on creating jobs and fixing the economy right now, which is why Congressman Alcee Hastings was so confused, as you saw just then, about why House Republicans set up today's work in the Congress as being a culture war day. These are the things Americans think should be Congress's top priorities right now. Even if you squint really hard at this chart, abortion will not appear on it. But Eric Cantor, the Republican majority leader, told the folks at the Values Voter Summit last week that he would bring up another anti-abortion bill for a vote in the House this week. So full speed ahead, jobs be damned, more abortion it is. House Democrats, who can apparently read polls and stuff, showed up for Abortion Day in the House today, ready to fight. They called Republicans out for waging a culture war today instead of working on jobs, jobs, jobs.
This bill is a misguided ideological distraction from what should be our top priority, getting people back to work.
It's very interesting that we're taking this bill up now when the American people are calling out for jobs. Their number one priority is the creation of jobs. And once again, we come to the floor of the House with a major distraction that ain't going nowhere.
Instead of focusing on jobs, Republicans are continuing to wage their war on women.
In March, they tried to close down the federal government over a woman's right to go to Planned Parenthood for health care. And today they are trying to close down a woman's right to life-saving treatment in our hospitals.
Americans don't want a war on women. They want a war on joblessness.
We're 280 days into this Congress without even having a jobs plan from the majority. Instead, the Republicans have chosen to continue their radical assault on women's health and health care.
Republicans have yet to pass a jobs bill. Instead of getting down to the business of creating jobs, they're bringing to the House floor a deeply flawed and deeply divisive bill that will not pass the Senate and would be vetoed if it reached the president's desk. They know that. I know that. Everybody knows that.
The American people are begging us to work together to create jobs, to bolster the economy. And instead, we're here once again to consider legislation that endangers and attacks the right of women.
Democrats came prepared today. Lots and lots and lots of Democratic members of Congress stood up today to deliver the same message about the Republicans' latest anti-abortion bill, essentially saying it's outrageous that you keep focusing on doubly, triply, quadruply banning abortion and attacking birth control and access to family planning, and you're still claiming to be so focused on jobs. Congresswoman Jackie Speer of California silenced the House chamber back in February when she spoke in very personal terms against another Republican anti-abortion bill. She talked about her own experience. Today, Congresswoman Speer gave another stirring speech when the Republicans went back and tried to do it again.
This bill goes to the farthest extreme in trying to take women down, not just a peg, but take them in shackles to some cave somewhere. 25 years ago, this body passed EMTALA, a bill that basically said anyone that shows up at an emergency room would access health care, no questions asked. Now, my colleagues on the other side of the aisle want to amend that law and basically say, oh, except for a woman who is in need of an abortion, or except for a woman who's bleeding to death who happens to be pregnant, or except for a woman who is miscarrying. Basically, what this bill would do is say that any hospital could decline to provide services to one class of people in this country, and that one class of people are pregnant women. Now, let me tell you something. My story is pretty well known now, but I was pregnant, I was miscarrying, I was bleeding. If I had to go from one hospital to the next, trying to find one emergency room that would take me in, who knows if I would even be here today? And what my colleagues on the other side of the aisle are attempting to do is misogynist. It is absolutely misogynist. The time has come for us to stop taking up this issue over and over again this year and do something that the American people really care about. They want jobs. They want to be able to hold on to their homes. They want some mortgage relief. And what do? We stand here on the floor and create yet another opportunity for women to be cast in shackles.
Joining us now is Congresswoman Jackie Speier of California. Congresswoman Speier, thank you so much for joining us tonight. I appreciate it.
My pleasure.
What do you think is behind the repeated federal anti-abortion bills over and over and over again in the House that you referred to in that speech? Is this really just a top priority for the Republican majority right now?
I think it's a top priority for the Republican majority in that they have done it already 7 times this year on the House floor. It is a way of stirring up the base and I think a way of generating campaign contributions. Call me cynical, but this particular bill on the House floor today was over the top, crossed the line. It basically was saying to pregnant women who are miscarrying, and pregnant women in this country, 30 million miscarriages a year, anywhere from 6 to 9 million women who need a procedure because they're miscarrying, and women that show up in an emergency room are not getting elective abortions. They're coming to the emergency room because they're hemorrhaging, because they have an infection. And in those situations, we're talking about anywhere from 600,000 to 900,000 women in this country every year showing up at emergency rooms in that condition. And my Republican colleagues are saying, you know, that emergency room can decline to offer services to that woman.
The bill today went through the long period of debate that it went through, first on the rule under which it would be voted on, and then ultimately when it was voted on. The House Republican majority did pass it. Nobody expects it to pass the Senate, and the president today has said explicitly that he would veto this measure. How important do you think it is? What do you make of the president's decision to issue a formal written veto threat, saying, even before it was voted on, saying, if this gets to my desk, there is no chance it will become law?
I think it's called leadership. I think he is sending a very clear message that he's sick and tired, as all of us are, of the charade that's being played out here. We have 20 more legislative days in this session, and we have yet to take up a jobs bill. We have yet to provide relief to Americans who are underwater in their home mortgages. It is time for us to show the American people that we're here representing them, not some ideologue in some fringe area in this country.
Your speech today, which we just played a chunk of, I imagine even though you know they are your words, you can tell that they are striking when people hear them. And you have spoken about this term in striking ways that get attention, in part because you've put yourself out there so personally. To see so many Democrats today speaking, not just in personal terms, but also with such aggression about the Republicans focusing on anti-abortion bills instead of jobs. I wonder if you feel like it does anything, if you feel like it changes anything, if it's going to have any effect.
Well, it is pretty depressing, I'll say that, Rachel. But this wasn't about abortion. This was about women who are pregnant trying to get emergency services when they are in distress. And to then twist it into an abortion debate, once again, was really just the antics that were being played out by my colleagues on the Republican side. And I think, frankly, many of those Republicans didn't even know what they were voting on. Because why would you want to deny emergency services to a pregnant woman who wants that baby, but who is hemorrhaging to death? Why would you want to deny them health care?
In terms of the jobs issue and the economics issue, Congressman Cantor, the majority leader in the House, has said he is open to voting on pieces of the president's jobs bill. I spoke with Senator Sherrod Brown of Ohio earlier tonight about what he thought might be able to pass, piecemeal or otherwise. He suggested that maybe investment specifically in schools, about infrastructure investment in schools and some of the other infrastructure investment might conceivably become law. Do you agree with him, or is there anything else that you think might actually make it?
Well, I do think that we can do a huge infrastructure bill, fix these bridges that are really not just in disarray, but safety hazards, the roadways, the schools. There's a lot of job-related work right there. We could also do mortgage relief for Americans. I mean, most of these
these Americans who have mortgages that they are struggling with are paying 6% interest rate when right now it's a 4% interest rate. If we just dropped it to 4%, they'd have $800 more in their pockets every month. Now, what's wrong with that? No cost to the federal government at all.
Democratic Congresswoman of California, Jackie Speer, appreciate your time tonight. I know it has been a long and intense day. Thank you, ma'am.